activities. This flood of dopamine creates a powerful reward signal, tricking the brain into believing that the substance or behavior is more important than food, relationships, or even survival. Repeated exposure to these intense dopamine surges causes the brain to adapt. It begins to downregulate its natural dopamine production and reduce the number of dopamine receptors. This condition, known as tolerance, makes it harder for the person to feel pleasure from normal experiences. The brain now demands more of the substance just to achieve the same level of satisfaction. As natural sources of joy become less effective, the person becomes increasingly dependent on the addictive behavior to feel anything at all. This shift in brain chemistry is a key reason why addiction is so hard to break. It's not simply about making bad choices, but about a brain that has been biologically rewired to seek artificial reward. Dopamine also plays a significant role in learning and memory, especially in reinforcing behaviors that produce pleasure. When dopamine is released, it doesn't just make us feel good. It also teaches the brain to remember the cues associated with that pleasure. For example, a person who smokes a cigarette while listening to music may later feel a craving for nicotine whenever they hear that same song. This is called cue-induced craving, and it is a major factor in relapse. The brain creates powerful associations between the dopamine release and the context in which it occurred, making it very difficult to avoid triggers. Another important function of dopamine in addiction is its impact on motivation. Contrary to popular belief, dopamine is not just released in response to reward. It is also released in anticipation of reward. This means that just thinking about using a drug or being in an environment where it is available can cause dopamine levels to rise. This anticipation drives compulsive drug-seeking behavior even when the person knows it will lead to negative consequences. It becomes a cycle. The person thinks about the substance, dopamine is released, craving intensifies, and they engage in the behavior again. This cycle of craving, use, and temporary relief becomes deeply ingrained in the brain's motivational system. Dopamine dysregulation also affects other areas of mental health. People with addiction often experience symptoms of depression, anxiety, or mood instability. This is partly because their natural dopamine system has been compromised. When the brain is used to receiving excessive amounts of dopamine from drugs or addictive behaviors, it becomes less responsive to normal stimuli. Everyday experiences that used to bring joy, like going for a walk, watching a movie, or spending time with friends, no longer feel satisfying. This emotional numbness can lead to deeper reliance on the addictive substance as the only perceived source of pleasure, creating a vicious cycle that is difficult to escape. The impact of dopamine on the prefrontal cortex is another factor to consider. This area of the brain is responsible for decision making, self-control, and forward thinking. Dopamine imbalances caused by addiction impair the functioning of the prefrontal cortex, making it harder for the individual to resist urges, weigh the consequences of their actions, or make rational decisions. This explains why people with addiction often continue their behavior, even when they are fully aware of the harm it is causing. The brain's reward and control systems are no longer working in harmony. Moreover, the effects of dopamine aren't limited to substance addiction. Behavioral addictions like gambling, pornography, social media, and even excessive gaming trigger similar dopamine responses in the brain. For instance, every like or message on a social media post provides a small dopamine reward, reinforcing the behavior and encouraging repeated use. Over time, people begin to crave these digital rewards, checking their phones compulsively and feeling anxious or irritable without them. The brain's response is the same: overactivity in the reward system, downregulation of dopamine receptors, and reduced sensitivity to natural rewards. Understanding the role of dopamine in addiction allows medical professionals to develop better treatment approaches. Medications that target dopamine levels can help stabilize the brain's chemistry. For example, drugs like bupropion are used to treat nicotine addiction by affecting dopamine pathways. Similarly, medications like naltrexone can help reduce cravings in alcohol and opioid addiction by blocking dopamine-related reward responses. Psychological therapies also aim to retrain the brain. Cognitive behavioral therapy (CBT), mindfulness, and motivational enhancement therapy help patients identify triggers, change thought patterns, and find healthier sources of reward. Recovery from addiction involves helping the brain restore its natural dopamine balance. This takes time, patience, and support. Healthy lifestyle changes such as regular exercise, nutritious eating, meditation, and meaningful social connections can slowly rebuild the brain's ability to produce dopamine naturally. While the cravings may not disappear overnight, consistent healthy behaviors can strengthen the brain's reward system over time. The plasticity of the brain, its ability to change and heal, is a source of hope for many struggling with addiction. In conclusion, dopamine is not the enemy, but when manipulated by addictive substances or behaviors, it becomes a central force in the cycle of addiction. Understanding how dopamine works allows us to move beyond blame and toward science-based treatment and compassion. By focusing on repairing the brain's natural reward system, individuals can regain control, rebuild their lives, and rediscover real, lasting sources of joy. The brain has a built-in reward system designed to encourage behaviors that support survival and well-being. This system relies heavily on the release of dopamine, a neurotransmitter that creates feelings of pleasure and reinforces behaviors. For example, when you eat food, spend time with loved ones, or succeed at a task, dopamine is released, and the brain marks that experience as worth repeating. This mechanism is what drives human motivation and goal setting. However, addictive substances and behaviors release far more dopamine than natural activities, overwhelming the reward system. Over time, the brain learns to associate these artificial rewards with an intense sense of importance, putting them above all other needs. When the brain starts to rely on these high dopamine spikes, it undergoes changes. First, it reduces the number of dopamine receptors and lowers its own dopamine production. This creates a condition known as tolerance, where more of the substance or behavior is needed to achieve the same high. Simultaneously, natural rewards like eating, socializing, or enjoying a hobby no longer feel satisfying because the brain is less responsive to them. The addicted brain is now programmed to seek out the drug or behavior, not because it feels good, but because without it, the person feels emotionally and physically unwell. This rewiring of the brain's reward system makes addiction a form of neurochemical dependence. While the reward system becomes overactive and hyper-focused on the addictive substance, the prefrontal cortex, the brain's control center, starts to lose function. The prefrontal cortex is responsible for rational thinking, impulse control, and decision-making. It's the part of the brain that evaluates long-term consequences and helps a person weigh options before making a choice. In addiction, this area is compromised. Brain imaging studies show that in people struggling with addiction, the prefrontal cortex becomes less active and less efficient. As a result, individuals may continue using substances even when they are fully aware of the dangers and consequences. They are not choosing the addiction. They are driven by a brain that has lost its balance. One of the key signs of this imbalance is the loss of control over behavior. A person addicted to a drug might promise themselves or others that they will quit, but find themselves using again just hours later. This isn't due to weakness or lack of willpower. It's the result of changes in brain circuitry that reduce self-control and increase impulsive decision-making. The more someone uses a substance, the more these circuits strengthen. It's like walking through a field over and over again in the same line. Eventually, a path forms, and the brain continues to follow it, even when there are better directions available. Another area affected by addiction, Have you ever wondered why some habits become so hard to break, even when you know they're hurting you, whether it's drugs, porn, gaming, social media, or even something as simple as scrolling late into the night? Addiction isn't just about bad choices. It's about how these things change your brain. In this video, we're diving deep into how addiction actually affects your mind. You'll learn what happens inside your brain when you're hooked, why it feels impossible to stop, and what you can do to take control again. This isn't just about substances, it's about behaviors that silently take over your life. So if you or someone you love is struggling, or if you're just curious to understand the truth behind addiction, keep watching. Let's break the silence, understand the science, and start the journey to healing your mind. Addiction is often misunderstood by the general public as simply a lack of self-control or a bad habit that a person refuses to break. However, modern neuroscience and clinical psychiatry clearly show that addiction is a complex brain disease that deeply affects the structure and functioning of the brain. This disease does not discriminate. It can impact people of all ages, backgrounds, and personalities. Addiction isn't a moral failing, and it cannot simply be overcome by willpower alone. Understanding addiction as a brain disease helps us remove the stigma from those who are suffering and opens the door to real, effective treatment and recovery. When someone becomes addicted to a substance or behavior, there are changes that occur in the brain's circuitry. These changes are not temporary, they can persist long after the substance is stopped. The human brain is made up of billions of neurons that communicate through chemical messengers. One of the most important of these chemicals is dopamine, which plays a critical role in motivation, pleasure, and reward. When a person engages in rewarding activities, such as eating, socializing, or exercising, the brain releases dopamine to reinforce those behaviors. But drugs like heroin, cocaine, nicotine, and even non-substance addictions like gambling or pornography hijack this system. They flood the brain with unnaturally high levels of dopamine, far beyond what natural rewards can produce. Over time, the brain starts to adapt to these surges. It reduces its own natural dopamine production and decreases the number of dopamine receptors. This is called tolerance. The person now needs more of the substance or behavior just to feel normal. Without it, they feel empty, anxious, or even depressed. This neurological shift makes quitting extremely difficult, even when someone sincerely wants to stop. Their brain is now chemically wired to seek that addictive behavior because it has become a shortcut to dopamine. This is what defines addiction as a disease of the brain. The system that once helped us survive and pursue healthy rewards has now been hijacked and rewired to prioritize the substance over everything else, even over food, relationships, or safety. The structural changes don't stop at the reward system. Addiction also impairs the prefrontal cortex, the part of the brain responsible for judgment, self-control, and decision-making. This is why people with addiction often make irrational choices, lie to loved ones, or continue using despite serious consequences. It's not that they don't care. Their brain's ability to evaluate risks and make sound decisions has been compromised. Studies using brain scans show that the prefrontal cortex becomes less active in people with addiction, and this dysfunction can take months or even years to repair. Furthermore, addiction also affects the limbic system, which governs emotions and memory. This system remembers the pleasure associated with the substance and triggers cravings when exposed to certain cues, like seeing a beer bottle or hearing a lighter flick. Even after a long period of abstinence, these triggers can lead to relapse because the emotional memory is deeply embedded. Just as a soldier with PTSD can be triggered by a loud noise, a recovering addict can be triggered by the mere sight or smell associated with their addiction. This is not a failure of character, it's a reaction from a brain that has been altered by disease. It's also important to understand that not everyone is equally vulnerable to addiction. Genetic factors play a major role. Some people have a higher predisposition due to inherited traits that affect dopamine receptors or the way their brain processes pleasure. Environmental factors such as trauma, neglect, or early exposure to addictive substances can also increase the risk. For example, a child who grows up in a home with drug abuse, instability, or violence may turn to substances as a coping mechanism, especially if their emotional needs are unmet. These early experiences can actually change brain development, making the individual more susceptible to addiction later in life. Addiction, being a chronic brain disease, has similarities with other long-term conditions like diabetes or hypertension. All of these require medical treatment, behavioral changes, and often lifelong management. Just as we don't blame someone for needing insulin, we shouldn't blame someone for needing medication or therapy to manage their addiction. In fact, medical interventions such as methadone, buprenorphine, or naltrexone can help stabilize the brain chemistry of people struggling with opioid or alcohol addiction. These medications don't get people high. Rather, they normalize brain function and reduce cravings, allowing the person to focus on rebuilding their life. Psychological treatments such as cognitive behavioral therapy, CBT, motivational interviewing, and trauma-informed care also help individuals understand their triggers, change harmful thought patterns, and build healthier coping mechanisms. Therapy can also address co-occurring mental health conditions such as anxiety, depression, or PTSD, which are often intertwined with addiction. Many people use substances not just for pleasure but to numb emotional pain. Treating only the addiction without addressing the underlying psychological wounds is rarely effective. Recovery involves healing both the brain and the mind. Recovery is a long-term process, not a one-time event. It often includes relapses, which are not signs of failure but part of the journey. In fact, relapse rates for addiction are comparable to those for other chronic diseases. Just as a person with diabetes may have occasional setbacks in managing their blood sugar, someone in recovery may slip up. The goal is not perfection but progress. With the right support system, medical treatment, and personal commitment, the brain can begin to heal. Neuroplasticity, the brain's ability to rewire itself, is a hopeful reality. Over time, as the person remains sober and practices healthy behaviors, the brain can restore normal function and reduce the risk of relapse. Understanding addiction as a brain disease is crucial not only for those who suffer but also for families, friends, teachers, and society as a whole. Instead of judging or punishing, we should be offering compassion, treatment, and support. Public health campaigns, school education, and early intervention can prevent many future addictions, but for those already struggling, it's never too late to seek help. The brain has an amazing ability to recover, and so do people. Addiction may be a disease of the brain, but recovery is a journey of the heart, soul, and mind. With the right knowledge and the right approach, we can break the chains of addiction and restore lives that once seemed lost. When a person consumes a drug or engages in an addictive activity, the brain's reward system, primarily the mesolimbic dopamine pathway, is activated. This pathway includes key areas such as the ventral tegmental area VTA and the nucleus accumbens. The VTA releases dopamine, which then travels to the nucleus accumbens, where it produces a strong sense of pleasure or reward. This feeling becomes associated with the activity or substance, leading the brain to tag it as something important for survival. The problem arises when this artificial dopamine spike overrides the brain's natural balance, causing the brain to prioritize the addictive substance or behavior above all else. In a healthy brain, dopamine is released in moderate amounts in response to activities like eating a favorite meal or spending time with loved ones. The pleasure is proportional, and once the activity ends, the dopamine levels return to normal. But addictive substances such as cocaine, methamphetamine, nicotine, or opioids release dopamine in unnaturally high amounts, sometimes up to 10 times more than normal activity.